I'm Dr. Joshua Williams, and I am the chair of the committee. I should point out that there is quite an audience for these meetings. I actually received correspondence from someone in North Carolina that watched our last meeting with great interest and had commentary. So whatever we're doing is of interest to many people in the world, it seems. So I'm calling to order, and I suppose we, as a matter of procedure, need to approve our agenda for the day. Do I have a motion to approve the agenda as it's been posted? Can anyone hear me?
Motion to approve the agenda.
Do we have a second?
Seconded.
Okay. All in favor, just say aye.
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 Anyone opposed? Say nay. Thank you. We have received a letter from Commissioner Kyle Ward, who was one of the progenitors of this committee, a member of the county commission who post hoc has suggested some ideas of his for things the committee can consider. In fact, he asks us to consider or investigate. Would someone like to read the letter for us so it's available to the public as well? If not, I can read it. All right. Thank you for volunteering to serve your community. I understand that your time is important, and dedicating it to solve issues our community faces is very honorable. There's been some confusion as to why the committee was created. As the sponsor of the legislation that created it, I hope to clarify that with this letter. I would like this committee to tackle one main issue with several parts. We at the county level don't always look at what's happening in city proper due to our division of powers with the city government. Unfortunately, in the city, we are seeing a poverty rate around 25%, and among our African-American community, we are seeing a poverty rate around 42% according to census.gov. It's embarrassing that 1 in 4 city residents lives in poverty. We also have a growing homeless population, and recently the city decided to disperse the homeless population from their main gathering location. This part of the community has also been hit hard from the pandemic economically and health-wise. These are not easy issues to solve, and since this is in the city, we at the county government have a limited toolkit to work with. There are a couple of issues I would like the committee to investigate. We can look at both government and the private sector to help solve these issues. 1, we have food deserts in parts of the city where citizens cannot get fresh food, produce to buy. 2, I would like you to look at our library system. We're in a changing world with fast-growing technology. What is the possibility of converting the libraries into libraries/community centers with different services? A, Knox County government offices from different departments. B, financial literacy classes for the community. C, community health instructor and health/workout classes. D, business centers for startup companies and business advice. E, after school programs and safe study areas for children with computer labs. 3, business development and job opportunity. 4, trade schools, apprenticeship programs, financial literacy programs in schools. And 5, homeless veteran programs. There's federal funding available to provide homeless veterans with housing options. Thank you again for your time and dedication to our county and your community. Kyle Ward, Knox County Commissioner, District 4. It occurs to me that in reading his letter, there may be some discussion about the contents therein. Would it please the committee to discuss this at this time?
Hey, Josh, I have one comment about it. I don't know if it lends itself to discussion or not, but when I look at the vastness of the items addressed in that letter, I think I'm the one who last month suggested that we go back to county commission and just make sure that we understand what we're being asked to do. And after reading the letter, I wonder if maybe I regret bringing that up.
I think he neglected to list world peace as something else that we should consider and solve. Like you, David, I found myself reading this and thinking, what does the commission do? What solutions have they looked at? What are they thinking to do? This gentleman has given us a gigantic agenda, suitable for a think tank, and I appreciate his effort. But I wondered if this was actually his thought process when he started this.
You know, I'm guessing that that it probably, I don't know, but I can easily see how a letter like this would. I mean, if you're saying address things that have to do with the health and economic well-being of the citizens, like it kind of opens the box theoretically to almost anything. But I know that it never dawned on me that I might be asked to help with homeless veteran programs via this committee, or what to do at the library.
And I think the commissioner's letter really opens questions for us as to where we left off, actually, where I kept referring to an identity crisis. Is this a work group? Are we a think tank? If any of the above, how often should we meet to meet objectives and goals? What are our objectives and goals? Do we want to break into subgroups to report back on any of these specific or other topics? How will we deliberate? How will we make recommendations to the commission or the mayor? In what form? Who's composing these? But David, you're right. We have what's John Locke called a tabula rasa, a blank slate. And we're in a position as a group of thoughtful and caring people to create whatever we want. And that's my understanding of this. And that's actually a much harder task than being told what to do.
I would just like to add that additionally, most of these items are being worked on at some level by a variety of organizations and departments to some extent, perhaps not to the extent that one might be pleased with, but it would, I'm never for working again, you know, in parallel lanes, but to work together. So for each of these many of these are being addressed. I'm not saying not to do it, but I would not say we hold all the expertise to take on every one of these areas without tapping into and intersecting with what's already being done.
And Kathleen, we also don't know the limitations of the county government in terms of what funding they have or don't have, or what powers they have. A lot of the things that are listed in this letter seem to be federally subsidized endeavors and not within the purview of the county commission at all. And it was my understanding that this committee was formed in an effort to bring clarity to issues confronting our community because of the pandemic. And some unhappiness with how our community, our business community, was facing restrictions and prohibitions as a measure to limit the spread of the disease. So what has been placed on the table for us with this letter is much, much bigger than that. And in fact, only in passing references the pandemic.
And Josh, this is Candace. When I was looking through this and I saw the county government having the limited toolkit, that goes back to your point that you were just saying. The issues facing the county as a whole, I know Knox County and Knox City, but they may be parallel, back to Kathleen's point, but also the county has some different monetary kind of restrictions than the city does. So is our role really, I thought we were the Knox County Commission. I didn't know what our role would be, if any at all, with the city, because the city does whatever the heck they want to do anyway.
Any other thoughts? It immediately begs the issue of what are we doing here? And it's still very ambiguously defined. And again, the questions posed by this letter are worthy of a think tank, but we don't have the resource. I imagine few of us have the time to explore where we're reinventing the wheel, as Kathleen points out, or we're actually offering recommendations of things that can actually come to pass. Any other thoughts? I don't think we're getting closure on this topic, frankly. We have an agenda that we can power through, and then we have this wonderful item 6, which is other business, which we can return to these questions with. But I'm not here to dictate terms. I'm really here as part of this team to figure out how we want to proceed and what we're going to do.
I would like to echo what I think David Moon was saying. I think our current charge is quite different from what I expected it to be. I am not sure that addressing some of those issues is within my sphere of competence. It's a great deal of time involved. I would like some clarity on what we are supposed to do before we do anything else. After that, I think we should turn to the topic of the pandemic, which I'm pretty sure, or our response to the pandemic, which I'm pretty sure was on our agenda, and that's what we agreed to do.
Raymond, I think that's why most of us stepped forward. I think we all have some passion about it one way or the other, and we have a wonderful divergence of backgrounds. And I tend to agree with you that we have things to offer on that. It's not a simple issue, but it is my concern, and by way of forward thinking, is that something that he refers to, the commissioner refers to in his letter, that I think he alludes to, is that very often our government is grounded in the here and now to the exclusion of forward planning. That we're always trying to plug holes in the dam and not looking for the next pandemic or the next earthquake or the next whatever it is. And I wondered if a group like this could offer some insight and some license to our elected officials to function in a slightly different way. We use it in, I know the economists in the group use the term leveraging. How do we spend some effort now for future benefits above and beyond the here and now and fixing things immediately? Any other thoughts? Well, it occurred to me after our first meeting, we started to exchange some email, all of which was interesting and helpful. But I am a long enough resident in this town to remember some scandals not that far long ago involving transparency in government. And even though we are a body of volunteers, we're not being paid for our time or our efforts, we are an extension of the county government. Thus, I believe that we are required to maintain the same kind of transparency that our elected officials do. And for that reason, I asked the county officials to give us a brief presentation on open meeting laws, because the last thing we want to do is transgress in some way that would discount or diminish anything we actually come up with or do. So is Myers Morton here with us today? This is someone from the law director's office that's supposed to be with us to present a little in-service on open meeting laws. Is anyone here in the group very familiar with these laws? Because I'm not. I mean, I don't want to transgress, but.
I don't see anyone from the law office.
My suggestion would be that, there's some terms about deliberate and whether or not a body like this can deliberate or not. Why don't we just skip this one and and move on to the next item and ask them to send us an email outlining how the open records law applies to this group and just some examples of what we can and can't do.
I think that would be great. I'm eager to speak to each of you, both as a group and individually, but I don't want to do something that would blow up later, frankly. So I think some guidelines would be very helpful. So we have on the agenda next, unless there's further discussion about that, I don't want to. Okay. We're going to have a discussion on the effects of mandates, curfews, and capacity restrictions on small business, and it doesn't stipulate who is wanting to discuss that or present on it. Is that person here?
Sorry. I had mentioned in the email that I just wanted to, because again, when I was asked if I would consider doing this, the mandates and the curfews and the capacity restrictions directly have an impact on not only my business, but my 15 employees and my expenses and my revenue and my taxes and pretty much everything. So when the county started adopting and not enforcing, but that's another issue, started adopting the 25% capacity and the 10 p.m. curfew and things like that, I was trying to explain to the county commission in previous discussions that probably won't impact necessarily Bonefish or O'Charlie's or some of these larger restaurants, because they have hundreds of employees, and they also get corporate money. They also get a lot more PPP money than I got, I can promise you that. And I still had 15 employees that were completely dependent on me to pay their rents and their car payments and their child support. I also had several employees that couldn't work because school was closed and they are a single parent. So in the restaurant industry, and again, I had to step in and go back to my kitchen as chef right now, just because I'm having a hard time hiring people. Nobody wants to work because they're guaranteed a great deal of unemployment monies still. And so it's not such a big deal for corporate America or for these deemed Home Depot essential and Lowe's essential and Kroger essential and all these other essentials. But for small businesses, it's a very big deal being forced to close, being forced to have curfews and things like that. So that's why I was asked to be on this board, just so I could kind of keep that front and center. I know the pandemic is dangerous. We've been dealing with it now for 12 months. I remember exactly where I was a year ago when I had to shut my restaurant down. I remember April 1st to April 28th when Trump mandated closures of small business, and I had to change my entire business model to become takeout and to go, or I just closed and went home and called it a day and went out of business. So I had to figure all of that out, as a lot of people have, and I just want to make sure that we don't get forgotten in all this. The science, the data, it was the curve, it was once the hospitals were okay, then we'd go back to normal. Once it was, the curve went down, we'd go back. Everything always had this scientific, we're going to follow this A, B, C, D, E, and then we're all going to figure this out and get back. And then it's vaccines. And now that's all the buzz is vaccines. And I'm just trying to figure out how to stay open, how to pay my bills, and how to keep 15 employees, not 150, 15 employees able to pay their rent. So that's kind of why I want to make sure when we go forward, if I'm a little passionate about the science and this data and all this stuff, I'm going to call BS on some of it, because when you look at other states like Florida and Texas opening up and counties eliminating their curfew, and those states aren't seeing an influx in curve, which we're all supposed to be scared of, I need to know how my state how my county commissioners and how my city officials are going to vote, and how we are going to be able to move past this as a community responsibly. And that's why I wanted to make sure that small business stays an integral part of this discussion. Thank
And
you.
you're telling us tremendous amount of collateral damage for steps that have been taken. Has anything been helpful at all?
So I will tell you, when we were able to open at 50% capacity and I was able to open up my patio, that was huge. Now, mind you, it was January and it was cold, but some of these simple things were able for me to, with the social distancing, I was able to turn tables certain ways. I installed plastic at my bar area so that if somebody coughed, it wouldn't intrude on drinks and food. All of my staff are currently and will continue to wear masks as long as that is necessary to keep us safe. But the things that helped, honestly, were the community support. I tried to explain this to Mayor Jacobs, and he came here and did an interview to let the people know that the small businesses need their help. Home Depot doesn't need your help. Lowe's doesn't need your help. We need your help. I got 15 employees that need to pay their rent. And I think once the county kind of started, instead of focusing so much on, oh, they're a bad person, ooh, they're not following the mask law, ooh, instead of taking the negative and just start showcasing the positive with news media and with Mayor Jacobs and some of the mayors or the county commissioners that have reached out, people in the community realized, wow, they do need our help. And that's kind of where I think we got lost in some of this. And 25% capacity, I only have 90 capacity. So that's only 30 people. How am I going to be able to make my rent with 30 people in my restaurant and not have food spoil? Or what are some options that I can donate food that's possibly on its way out because I can only have 30 people in my restaurant? I mean, these were some of the things that I felt the county needed to address. I know several restaurants in the city have closed and since reopened, and people are figuring it out. But again, it's been 12 months. We better figure it out. So we've had to figure it out.
I find, first of all, I feel for you. It's a terrible thing to go through when you care for your employees and you love your work. And to have something like this happen is just nothing anyone ever prepares for. And I don't have a rebuttal per se. I have nothing to say, but what I do find myself thinking about, and I think Dr. Chu will probably bring up similar concerns later, is what do you do if the things that are impinging on you, the things that are strangling your work, are also necessary in some way? And how do we as a community take care of our people like you? How do we do both things at once if that's what we have to do? And I'm not pretending to have the answers to that, but I think that's the real question. It's not to say you shouldn't have your livelihood and your employees shouldn't pay their rent. How do we make sure they're okay while taking care of our whole population at the same time? And
I think we need to be very careful where the burden of proof lies.
the burden of proof pertaining to what, Raymond?
Whatever action we take. It is not incumbent on a restaurant to prove that they are allowed to do business. It is incumbent on governmental authorities to prove that they have the right to ruin people's livelihoods.
Yeah, I'm saying that it doesn't work that way necessarily. In a perfect world, you could do both. You could say that it's not safe to have congregations of people in a time of an epidemic, but we need to take care of people whose livelihood depends on people congregating there. One thing doesn't rule out the other. But you're saying it's governmental overreach.
Yes, I am.
I hear you. So
It definitely has felt like it. I will tell you that.
yeah. And Candace, I think one of my imperatives is that everyone feel like they've been heard in this endeavor. That's why we have lots of room to debate the merits of everything, but for right now, we're getting acquainted, and I think we want to hear everyone's perspective. Right. I'm sorry, Jim, I cut you off.
Oh, yeah. So I just wanted to kind of parlay into a discussion about what has been going on. Because, early on in the pandemic, there was a lot of unknowns. There were a lot of predictive models that were out there that were used to justify the closures of businesses in the entire country, the entire world. And so that was based off of predicting the future. But now we have a lot of data right now that has we have a lot more knowns. Exactly what types of populations are most at risk for the disease, and who would suffer the most mortalities, and what segments of populations are least likely to be involved with serious comorbidities, serious problems. But however, we also have granular data. I think what I'm excited about this particular commission is, having worked on the state level, sometimes it's very difficult to get collated data from various segments throughout the state. But now, if we're able to tap into those sources that are right here in the county, it can be a much quicker process in order to give advice, which I think is what we're supposed to be doing for the mayor. In particular, whether or not he takes our advice and uses it into policy is up to him. So I don't think it has to be that difficult as far as trying to figure out what we can do, because ultimately the policymaker will be charged with listening to the advice or not. So, but the advice can be driven by data and information. And so I've taken upon myself to talk to a lot of different people that I've worked with on the county level to give data to this committee in order to say, okay, what has been going on in 2020? What are those things that are very, very serious as a result of this new experimentation of lockdowns and economic restraints that has been a historic change, and because now we're seeing historic numbers, okay? And some of that is not in a good way. So I will say right now, in the past, when I received this data from this medical examiner's office, this data was not complete. So this is data that I received in February 2nd or thereabouts of this year, 2021. The complete data set will not be finished for another month or two, and that will be obviously public information. But up until that point, we had about a 72% increase in homicides in 2020. Drug-related deaths had increased by 30%. Let me put this into perspective, because I've been working for a long time now on the opioid crisis, drug-related issues throughout the state and here. From 2018 to 2019, it was the first time we had seen a decrease in drug-related deaths. You can almost see what happened in March of 2020, where we had some nice deaths, decreases in deaths in January and February. March 2020 hit, and we had an explosion in drug-related deaths at that point in time. So there is no doubt that some of the measures, the uncertainty, everything that's been going on has exacerbated health-related issues and outcomes for certain segments of the population. And we have struggled for a long time with neonatal absence syndrome, drug-related deaths here in Knox County. There has been a tremendous amount of efforts by multiple leaders, city, county, Metro Drug Coalition, a whole bunch of individuals wrapping their heads around how to help with this problem. We almost, sadly enough, a lot of those positive efforts were turned around in one fell swoop. We are on track, sadly, as well in 2021 to surpass all of those numbers as well. So when I looked at some of these homicide numbers, and what was also that struck me as a point of further investigation was the amount of white females that had been victims in homicides in 2020. It jumped up 500% in 1 year. Made me think about maybe intimate partner violence, domestic abuse, and where I could get some of the information on domestic abuse. And so I reached out to the Family Justice Center, and of course, It's always enlightening when you talk to these leaders, what they see from their perspectives, what has been going on in their eyes. And of course, sadly enough, when you lock down, you have individuals that can't go to work. You have victims, potential victims, stuck inside their homes with their abusers now, with the victims having less opportunities to get reprieve, escape, engage during lunchtime to the Family Justice Center to come up with a plan to move on out of their poor circumstances. Family Justice Center has now just been able to do in-person counseling within this past month. The entire time they've been doing it all through iPads and meeting in the parking lots. Another insight that I never knew about, would have never have guessed, is that virtual schools, if you've got a child that is in a poor circumstance at home with an abusive relationship, well, our teachers oftentimes are the ones that notice the marks on the skin and the abuse, signs on the body. But when you're in a Zoom meeting from here to here, that might not be as obvious. So we have to understand that when we are talking about public health and we're talking about these serious issues, we're talking about multiple, vulnerable populations. Okay, when we're talking about the disease, obviously our elderly with comorbidities, 70 years and older, we know that those individuals are at most risk for serious problems with COVID. But we have other vulnerable populations that we completely have almost forgotten about. And what are we seeing now in our communities? Homicides, drug-related deaths. I can't even tell you how sad it makes me to think about what is going on in Austin East. So we have to, it is based off the granular data that we have here in the county, okay? I will tell you one thing that has been taken away from all of us in this experimental year of 2020, the pandemic, is our infrastructure, okay? In-person schools, people meeting, in person more often. And also, as Ms. Viax had mentioned, the capacities at work, the economic viability. When you restrict some of those things, there's going to be, not sadly enough, collateral damage. And I hope this is a call for a push towards not a new normal, but back to par where we were. We should be also pushing very, very, very firmly and fast towards getting our kids back into school face to face. That relieves a tremendous amount of pressure off of our family members and others who are trying to take care of these kids. There's a lot of data about achievement gaps and what that will do to the economic well-being and physical well-being of a lot of our children, mental well-being, that we know has been a part of the problems with lockdowns. And I will say this too as well. So I think it was either Mr. Moon or Dr. DeGennaro who was asking about hospital capacities when it comes to COVID. So I've been able to reach out to some chief medical officers at some of our hospital systems. I'm about to sit down with them and talk with them and listen to what's been going on with their hospital capacities. I've sat down with and spoke with chief medical officer for one of the largest, if not the largest, primary care conglomerates here in the area. And what is encouraging to hear is that the vaccines that have been pushed out into the community, at least in terms of primary care and health department, they've really been trying to target the 70 years and older populations with it. And they've done a really, really good job of trying to get the vaccines out into those areas. We're seeing a drop in the amount of cases in the hospitals right now. And so I'm encouraged. We should, if we're to give advice, I think the advice is, hey, let our medical providers keep on doing what they're doing. There's a bunch of smart people using as much logistics as possible, logistical thinking and prioritizing health needs right now, getting the vaccines out and whatnot. I think a lot of these individuals are also cognizant of the fact that there is a lot of social distress with alcohol-related deaths, drug-related deaths, and there is a push and an urge to get back to normality. And if there's any advice before we start looking at these important things that our commissioner has charged with us, if we were to prioritize our efforts right now, is a restoration in infrastructure may help with a lot of the maladies that we're seeing around sooner rather than later. As soon as we can get to that, maybe that we can start ticking off the list, that extensive list of the commissioner and other issues that we want to address. But I think there's an acute problem right now, and we need to address it sooner rather than later. Thanks.
So you've given us an excellent appraisal of the community data. It segues sort of backwards into the Great Barrington Declaration, which you've also asked to tell us about.
Yeah, and I think that's for everyone can pull that up, the Great Barrington Declaration, and it sure is not without its controversy, but these are very smart individuals that have put this together. Public health officials, epidemiologists from Oxford, Harvard, and Stanford. They are some of the top in their field. There have been a tremendous amount of support from other healthcare leaders, concerned citizens and whatnot, to look at the data in a maybe slightly different way than some of what we have been presented, by our own public health officials, and just an alternative look. And part of it is focused protection, making sure that our elderly populations who are most susceptible to COVID and mortality, they're protected. I think our community is doing that right now. It sounds like to me with the vaccine schedules and whatnot, but also calling the attention to the fact that our children who are less likely to die from COVID than influenza, that they are allowed to get back to normality sooner rather than later as a result of the scientific literature that has outlined some of the problems that are going on with kids mentally, with their education achievement gaps, and with a whole host of other problems, taking a different look at public health in its totality. I think some of this stuff that they had mentioned back in October is I know at least in the county level, they seem to be moving in that general direction anyway, especially as the vaccine has come out. I just am calling, but what we don't have is that granular county data that we have now in our hands to show that even the Great Barrington Declaration and writers never talked about the increase in homicide, and because that might not be a reality across the world, but is a reality here in Knox County, and the drug-related deaths, which are particular to each region. But we knew that this was going to be a potential problem here. It was sadly enough, it was worse than I thought it was going to be if I were to have predicted back in March in 2020. So I just feel very strongly that for the and I won't get into trauma-related issues and as it relates to children's health in the future is something that I talk about a lot and I do a lot of education on, but it is absolutely devastating for children to have experienced traumatic events, shortens children's lives in the long term. There's a lot of issues that we need to address now, and I hope that there's with this data, there's a call to urgency for normality.
But by way of proof that great minds don't always think alike, as you mentioned, there is controversy about the Great Barrington Declaration, and the counterpoint, I think, is the John Snow Memorandum, which was generated by an equally robust scientific community that takes issue with a lot of the points in the Great Barrington Declaration. The most striking thing that I read was that the CDC suggests that up to 40% of the American population has pre-existing comorbid conditions that make them vulnerable to the detriments, the devastating effects of COVID-19. And so it would be very hard to follow through on a lot of the Great Barrington Declaration without considering those things. And I'm not looking to have a public debate about it, but you're right. There are some wonderfully delineated collateral issues caused by the social isolation and the closing of businesses and so on. I think those are irrefutably true. My problem is that they don't always mean that we're doing the wrong thing. It just means this is a terrible thing that's happening because we're doing the right thing. I'm reminded that for everything that mankind has done by way of progress, there's always been collateral damage. We built wonderful hydroelectric dams and killed species of salmon. Should we not have built dams and made cheap power? I'm not the judge of that, but somehow we need to take care of the salmon too. This is very interesting material for us as an intellectual pursuit. I'm not sure where we go with it as a committee in advising the county commission and the mayor. But I do appreciate you. I'd never heard of the Great Barrington Declaration before, so it was very useful to learn about it. Any other thoughts about it? Kathleen, as a community health expert, I'm sure you're privy to the debate. Do you have
Well,
any?
and I agree, there is the debate, and there's, I think, people with equally impressive pedigrees on both sides that come from actually sometimes the very same institution who
Right.
do not agree. What I would hope for is a civil discourse, civil in that we can agree to disagree, to discuss. And too often I feel like the immediate response is they're bad, they're good, and vice versa. And we get nowhere but to continue to polarize and to divide. And that's not going to lead to solutions. I sit back and listen, and I wonder if there's some thought that there are people who want others to suffer, who want people to go out of business, who want people to die, who want people to be murdered. I frankly don't believe that. Call me naive. I have worked with lots of people in this community, from hospitals to public health, to in the government, in private sector. I find people seeking, striving for what will keep us safe, functioning, productive, healthy, alive. If we divide ourselves, we can't make progress. And both sides, these documents, whether it's John Snow or the Barrington Declaration, great. There's interesting information coming out of both of them. Very meaningful, well documented, supported by evidence. How do we move forward? None of these decisions have been easy. To close businesses, it's not easy. It's not a desire to make people suffer. We were working with an evolving situation that did not have historical, yes, pandemics. Actually, there've been, certainly throughout history, but to watch this one unfold and to be making decisions, probably some of the hardest, most stressful decisions many people in those positions have ever had to make in their life. In public health, we've seen the fallout. We've seen suicide. We've seen people fired who have resigned, who say they can't take the pressure. It's been merciless. These are not bad people who want others to suffer, nor do I believe that of any sector. I think it does take working together. And to the point that was made earlier, and I think Dr. Williams, you said it, we can't have a situation like this without some kind of damage. We don't always know which sector is going to experience it. Certainly when we close businesses, that becomes apparent. I don't have a better suggestion in terms of what we should have done. I know Monday morning quarterbacking is a whole lot easier than quarterbacking during the game. So we can point the finger and we can take exception. I would contend we've not yet seen the impact of the elimination of mandates. My brother lives in Texas. He said people were last week driving down the street throwing masks out the window of their car, as if this is over, gone, and done. And he's also in the restaurant business, knows very well what it has felt like throughout this, and what it's meant to the business. That's where my concern is, when we convey a message that we no longer have to worry, or that it's over, or that masks are no longer necessary. I'm not sure what's going to happen. I don't even want to say I'm going to predict an uptick, because I think as soon as anyone says that, it does draw, some degree of criticism around, you live in fear, or you live in this, or you're, just thinking the worst. I do understand how infections are passed, and I think we may see some uptick. I hope it's nothing like we've seen before. So this is actually still an evolving situation. There's still some unknowns and lack of clarity about exactly what those predictions may reveal, or what the predictions may pose and question. We need to get kids back in school. I agree. We need to get business open. I agree. But if we put kids back in school and many of the adult teachers are sick and out and can't teach, we're faced with some of the same situation we've been faced with in the past. So
Have you heard of?
what remains to be seen, and I hope we will not, by any means, abandon some of the precautions that are still perhaps indicated.
I will say this. I think we have a lot more, like I said, we have a lot more knowns now than unknowns.
Mhm.
We have data that now what has been going in our community and also worldwide. I want to be careful to say that some of our in using the retrospective scope to cast aspersions and harsh judgments on those who are in the line, on the front lines trying to make those hard decisions is completely unfair. However, we now know what has happened to those who were at most risk for COVID, and what has happened to our society, Knox County right now. So, and we have a good forecast of what's to come, which is the increased violence. And if we were to break records this year, from 2020, we've had historic numbers, and we go on to 2021. At what point in time do we say enough is enough? So I do want to keep that in mind as we move forward, because now we know where we're heading when it comes to drug-related deaths and the exceptional amounts of violence that we're seeing here in our county. So I know that's a huge, animal to get our hands around, but certainly the one variable that has been changed is the constraints on our infrastructure. That has there was always smoldering issues, right? And then with the infrastructure that has been taken away, it's fuel on the fire. And that, I think we have seen that, and we know that is a reality. And so and the other hopeful thing that I see is that we have the vaccine now. We have a vaccine that has been distributed to our most vulnerable individuals, if I'm to believe our community health leaders. And I do. And that's been remarkable work by a lot of medical professionals that have been out there and vaccinating, including our health department. And so they're doing a great job trying to get their vaccines into the hands of other individuals. So I think this is not a a dark message. I think we have that information. That information is vital in order for us to say, okay, where do we have a pressure cooker here? Okay, how do we let off the pressure cooker in order to restore normality? It doesn't mean that You don't have to rip the Band-Aid off like maybe Texas and Mississippi, but we certainly need to kick the ball forward, I think sooner rather than later. How we stage that, what's our advice? That's up to everybody. I think that's up to everybody here, but to hold back and say, hey, let's just kind of wait and see, just like we have been before. We know what is going on right now. We know it's happening, and we need to move that ball forward. Doesn't mean that we have to do it all at once, but where can we do it first in order to impact things in the positive way sooner rather than later? My opinion, I think schools would be a very, very important first step forward. Businesses, Candace's small businesses, those are sensible ways. We still need to protect those who are vulnerable from COVID. And I think our vaccination programs is doing the best job that we can. I think our community health leaders are doing that. So I have a much more hopeful, kind of feel for those that are the most vulnerable. We've got smart people working on that right now in our community.
My concern is that the things that you catalog as problematic as a result of doing perhaps the right thing is the issue. If infectious disease experts tell us we need to confine ourselves and do the steps that we've done to limit the spread of this disease, doesn't mean that bad things won't happen with homicide. And I have a patient who works in a liquor store that said there was a huge spike in business when we started shutting things down. There's no doubt that that's true, but the solution to that isn't necessarily giving up on infection control. And that's where it gets more complicated.
I would say that we have a lot more infection control measures right now with the vaccine that's given to those who are most vulnerable. That was not a reality a year ago. That was not a reality 6 months ago. It is a reality here in Knoxville in the past month or two. So I would say that that variable has changed, and we're seeing it at the height of respiratory season right now in our hospitals. Our hospital numbers are going down as far as those who are in the ICUs. So being in touch with that community data is really important to say, okay, I don't know what's going on in the bigger cities, but we can grab onto that data here in our county and make those decisions by engaging in the hospital system and say if they're seeing this downward trend and they're seeing that the vaccines are getting out to the most vulnerable, I think that's a hopeful sign. And so so we need to use that as a potential means to say, okay, can we move the ball forward? We can do that sooner rather than later. And I think that, and because of everything that we're seeing right now in our community, I would urge you to talk to the county, to a homicide investigator right now. I would urge you to do that at some point in time and see what.
No one is questioning that those things are happening. That's my point, is they are happening, but that doesn't mean you shouldn't be doing the other. I don't think that they're mutually exclusive.
And we are doing the other. So, and I think that is the great thing. Our healthcare leaders are doing the other right now as best as they can with the best tool that they've got, which is vaccine, giving it to
the state of Tennessee is 47th in the nation for vaccinations. So we have a lot to improve on even there.
But we're also seeing a downward trend in the hospital numbers too. So I'm
seeing an upward tick in long haulers. A great proportion of my practice in hospitals are people with residual COVID effects that are going to have a lifetime of struggle. So there's no number of infections that's acceptable to me as a practitioner. Just saying anecdotally that the ICU beds are freeing up, and I'm glad for that, but the acute care beds are filling up.
Well,
hey, but I have a question. Why then, if that's the case, and we're sitting here having this conversation, then why can't the campaign change its message? See, this is something that I've always kind of, if everybody is in agreement that we know more, according to Dr. Chu, we have now the mental health aspect that we have to consider. Now we have the education and schooling of our children in our communities. Now that we have 12 months of data, why can't there be a county campaign that says, if you're vulnerable, if you're older, if you're whatever, stay home? Why? Why does everybody in Knox County and Knox City being told to stay home or social distance or continue absolutely, your kids can't go to school. We can't help you if you're an abused woman and you're stuck at home with your husband while he's beating you. No, you can't go to church. That's not safe. Why can't we begin to move the ball the way that the doctor was just telling us, not disbarring everything that we've already learned? Stop for a minute and go, this is what we've learned. Now, like you just said, Dr. Williams, now we know the most vulnerable with the acute issues, they are the ones that need to be protected. Why does the 18-year-old or the 8-year-old be disallowed from going to school when we have the data and the proof now that that's not the threat? Why can't we change our campaign?
Dr. Chu, do we know with certainty who's going to get sick?
I think the most certain information that I have is that, if you're 18 and younger, that you're less likely that the common influenza in that particular age group is more deadly than COVID. And so we know that for 70 and older with comorbidities, the COVID is a much more serious disease than the flu by a long shot. And I think that's why the community physicians in this area have targeted smartly as best they can that subsection of individuals first, and getting their vaccinations to that segment of the population. So smart people are doing that in our county, and I can attest to that by talking to chief medical officers at some of these bigger institutions, and I'll be talking to more. So I think the medical community understands the role of juggling these public health as a whole, the 30,000-foot view, saying, okay, there is a pressure cooker. They understand the drug-related deaths. They're very concerned about it. They're working like mad to protect those who are vulnerable to COVID, and I think they will be hopefully done with that very soon. We're seeing those numbers drop in the hospital, so I think that those data sets are very important to us because like I have close personal experience with a teenager that has committed suicide last year. And just like you, I think that's unacceptable outcome. And we also have some close personal experience with intimate partner violence, and I think that is unacceptable as well. So we can't put a price. We know so much more now. We have so many more tools, I feel like, for our community. We have smart people moving the ball forward and prioritizing those who are most vulnerable in those areas. We need to readdress the infrastructure and getting it back online because but I think a lot of healthcare individuals would feel the same way too, and they understand that. So we're not alone in understanding those various kind of variables to manage. I think there's a call and a push to move things forward, and I think a lot of healthcare leaders feel the same way.
Kathleen, I cut you off. Was there something?
That's okay. I just I don't know if you want to call it full disclosure, but some of the guidelines are changing. They are changing in response to the fact that we have been vaccinating and we're making inroads to vaccinating where different measures that don't require some of the same more strict guidance and restrictive activity. We can be with I can visit my in-laws who place was, on quarantine for since last March. I can now go into their apartment. They're eating in, the dining room again. So, but they didn't get COVID and they're fully vaccinated and they're happy to have been part of the ones that stayed at home. Do they want to go to a restaurant? Absolutely. But we are now seeing, because of having that vaccine, of having knowledge, and yes, a lot of data and information, better understanding, that we can start using some of this. I know kids that have been going to school in person. So we're not making all kids stay home. So when I hear we got to get kids back, yeah, get them all back. But there are some children in Knox County going to school. My grandchildren have been going to school face-to-face the entire year. I know friends of mine whose children go to the public school, they've been going to school. Might they have some of the schools gone to remote? Yes, under conditions when they were unable to sustain that face-to-face. So it hasn't been for an absence of trying and disregarding the serious impact. It is very serious. But we're also dealing with something that is infectious, that does affect all ages, yes, very differently, at different rates, but where we have whole families that are sick with COVID across the age groups. So again, I think we're trying to move in the direction that we are proposing we should move in. It's probably not as fast as everyone would like. It would be great if we could have done this, last year, but that's not what the prevalence of the virus and the cases really supported doing. And while there are still the proposal for some of these protective measures, there's also some loosening up around how often, how we can get together, when we can get together, places staying open longer. And to that, I've been in places where I've seen quite a few people who have not followed any of this. So we do have quite a mix. It's not that we imposed some of these measures and had 100% compliance. So all along, there have been lots of people who have disregarded the recommendations and went about in the stores and in different places at will. So we've had restrictions, but we haven't had the complete compliance, and nor have we been totally locked down to the extent some perhaps other areas have.
I have two thoughts. One is, I don't know, there was something on the news the other night about how the Israelis have been meeting the pandemic, and they were the first country to pay above retail for the vaccines, and they've had massive campaigns for vaccinating people. My favorite is to get young people. They've been giving vaccines in bars, and they have a program called A Shot for a Shot. They give you a shot of whiskey if you'll take a shot of the vaccine. If I hear a common denominator in all the different views that we've been sharing here today, is that we place a great deal of hope on the 3 vaccines that we now have. And yet, as you're pointing out, Kathleen, the whole reaction to the pandemic has been unfortunately politicized over the past 3 years or 4 years, but most recently last year, healthcare has been politicized. And I'm wondering if there's some point of agreement that we could find a way to encourage our commissioners to promote vaccines as a major step towards containing the pandemic in our community. That is the one thing that we know has potential. Oh, the part I really like about Israel is if you can show that you've had both vaccines, you have unfettered access to restaurants and theaters and groups. They carry a what they call a green passport on their cell phone. So once you've been vaccinated, and I guess plus 2 weeks or something, you're free to rejoin the world in I'm sure with some limitations, but in a way that we haven't gotten to here. I cannot imagine our society accepting that model per se, but maybe something closer to it would be something we could all endorse.
Joshua, I'd like to break in here with 2 comments. The first is encouraging people to get vaccines hardly seems a step forward when people are lining up to get vaccines as it is. We cannot vaccinate all the people that want vaccinated yet. So making the line behind them longer seems to me a waste of effort. Vaccinate as many people as we possibly can. But we're not to the point where the 75-year-old who is afraid of the vaccine doesn't get a shot and there's no one to take it. You give it to the 65-year-old that wants it. So we have plenty of people that want the vaccine. Getting more people in line is not it. The second thing is, you had quite some time ago asked, who can we tell who will die? And the answer is, of course not. But I'm looking at the Knox County site right this minute. And for the entire pandemic, the number of people under the age of 17, that is school age, who have died of COVID is 0, which I think is moderately strong evidence that that population is not at risk.
We've had a historic rise in juvenile homicides.
And
Unfortunately, it doesn't take, I'm sorry, go on.
the second thing about that distribution, anticipating your second point, I think, is that 322 of the approximately 500 and some odd people, 322 of those are 75 and up that have passed of COVID. I do not think those were the teachers of those students. That leaves 65 and up with 133. In other words, under 65, fewer than 100 deaths in all of Knox County.
Yeah, that's quite an impressive statistic. What's missing is that we have no way of knowing the transmission that these 18-year-olds are capable of having, where they have symptom-free COVID response, but they're transmitting the disease. So,
and this hypothetical that you're describing, we have no way of knowing.
And also,
actually,
the fact
guys,
that our vaccines are being distributed to the elderly. And our medical community is doing a wonderful, wonderful job of prioritizing those individuals. So that's a very, very helpful situation. So there's nothing wrong with natural immunity. There's a lot of people that have natural immunity thus far. And we are also getting a vaccine to our elderly who are most sick. So that's a good.
I have to say I'm grateful that the deaths of the age groups that young are so low. That's wonderful. It's ideal. I don't want people to die. I'm not happy that older people die, frankly. However, the impact of this is not just measured by death. The impact is also measured by morbidity, or the degree of illness, the illness that keeps people out of work, out of school, or being able to function in their everyday activities. That yes, it's a small percentage of people who who contract the infection and end up in the hospital, a smaller percentage of those that end up in the ICU, and a percentage of those that die. If we measure it solely by death, that's doing a disservice to all of the other impact of the infection itself, and the toll infection and being ill from it takes on the individual families, the community, our society.
And I think this is where it comes back to what Dr. Chu says. Yes, that's something to consider, but we also have a less death rate of COVID and a higher death rate of suicide and homicide. So which deaths are we going to count?
We're counting them all. I don't quite understand the, we're putting a value on, it feels like some kind of value on deaths from COVID and suicides. They're both, hopefully many are preventable, and that should be our goal. To the extent that we have this rising problem in violence, in suicide, in overdose, and so forth, is equally a challenge and serious problem to this community. The solution to that is not just going to be dismissing COVID and not addressing it. We must then increase the response, prevention measures, and also the response to these other issues to address them within the context of COVID. Because COVID's not going to go away. And these things are equally as serious. So I don't rate one death against another. I don't see that at all. They're both tragic and serious and have implications for our community. And neither of them should be dismissed nor treated as if taking away the restrictions are going to solve all the suicide problems and the excess death from overdose. I don't think that's going to happen. I don't think there's strong enough evidence also to prove absolute cause and effect. There are multiple contributing factors to these increases. Yes, the situation presented by COVID definitely contributes to the social isolation, to opportunity, to stress. But a lot of those things were there and they're exacerbated by this. How do we respond within the context of this other situation we've got, which is equally as serious, which is taking people's lives, which is causing long-term disability, which has interrupted everybody's life. I don't know someone unaffected by COVID, perhaps not personally. Maybe some of you still don't know anyone who's had it or know of people who have lost family members or friends due to it, but I don't feel that it's any less serious.
So Dr. Chu, when you shared earlier about in March of 2020, you said, and again, maybe I'm misquoting you, so I'm sorry, but you said either the homicide or the suicide rate was directly related to the shutdowns or the COVID. March of 2020 is when there was a huge increase. So in your medical opinion, obviously dealing with the drug issue and having background in this, do you think that the opening of churches, the 100% opening of our schools, the social doctor appointments to be able to start back, I mean, do you think that these things would help bring down the death rate, the drug rate, and the suicide rate that our community is now facing because of COVID? Or do you think this is just going to be something we deal with for the next 12 months and we pick up later?
I think mostly this is a call to urgency to restore infrastructure. I mean, I think to speak directly on the data points that I was looking at, and I gave it to the committee, and the full data set will be finished by the medical examiners here pretty soon. So everybody can take a look at it, but it's specifically drug-related deaths. We were doing a great job in Knox County with in decreasing the drug-related deaths from 18 to 19. And there was an actual decrease in I believe the February and January numbers of 2020, but when March hit, there was an explosion of drug-related deaths, and it continued to be high and break all records in Knox County, I believe. And those are preliminary numbers. Unfortunately, those numbers may look even more different when the final numbers come out. And so right now we're off to a start in 2021 to break the 2020 records thus far in drug-related deaths, homicides, and maybe even suicides. So, this is a call to urgency. Okay. So to say, I think it's undoubted, it's without a doubt that when our infrastructure and our communities are drastically changed, when isolation is a key component of a measure of the pandemic of last year, we know what it has done to our communities in some ways. And then we also know what has happened in other health-related issues. So cancer screens went down, the heart disease, some of our we know worldwide that there were a lot of individuals that were scared to go to the doctor's office, and so a lot of the preventable coronary artery disease, heart disease, were exacerbated and worsened. So there were a lot of health outcome measures that were worsened as a result of some of the responses to COVID. But I will say this: I think we can all agree and be happy that our community of healthcare leaders today have done a remarkable job of distributing vaccines to our most vulnerable COVID population, and they're continuing to do that. I think that is a wonderful thing that our county is doing, and I think that is something that we can all be proud of this county, that our primary care physicians and our health department is distributing those vaccines to whom they deem as most susceptible, and they're marching it down the next tier to the 60 and older group, the 55 and older group with comorbidities. And they will be doing a great job with that in the coming months. So we know that those who are most vulnerable to dying are being protected now. And so this call to urgency is the data that we're seeing in 21 and 2020, and knowing that if we want homicides, if we can help with homicides, if we can help with drug-related deaths, that the restoration of infrastructure will be I think, a easy first start. And we'll see where the data lands in making our small businesses economically viable. More certainty, not less certainty, when it comes to all of this moving forward. I think that message is incredibly important moving on. And I think we're doing that. I think our healthcare leaders are doing that. And we're seeing the hospital numbers decrease for COVID, but we're not seeing the hospital numbers for gunshot wounds decrease. And so we have data. We know what we're dealing with right now. We have great leaders that are moving the ball forward with COVID and the vaccinations. And that's why I think that the granular data that we have here in Knox County, if I can reach out to these healthcare leaders and hear what's going on with that, we can make decisions more quickly here in the county, or at least advice. It's up to our politicians to move on that advice or not, based off of what's going on here. Not so much what's going on in Texas, California, all that kind of stuff, but what's going on here. And so I think we are, I'm trying to nudge it forward and say, hey, let's get our infrastructure going again.
Is it possible that some of the improving trends that we're seeing are in fact the result of some of the mandates that were in place? Is it possible now that we'll see additional improvements because of the vaccines? But looking back, would we be in worse shape or better shape had we not had the lockdowns that we're hearing people object to now?
Well, I think you could look at California and in Florida. Cases per 100,000 were higher in California versus Florida. So that's a very difficult question to answer. But I think in the end, the past is the past. The decisions that were made, various states, counties, wherever it was happened in the past, we're moving forward. We've got a vaccine now. We've got community leaders that have distributed far and wide in our county. And that's a good thing. So, and we are currently seeing the numbers going down in the hospital system. So, I don't want to bemoan what happened, who should have done what last year. I just know what's going on now and where we hopefully can move forward from.
I would ask our market people here whether they think we can ever get back to the baseline we left last March, whether there haven't been irreconcilable changes caused by what's happened to small business, to investors, to employers across the board.
Josh, we'll get back to it depends on whether you're looking at it. This is my opinion, Raymond. We're on the macro or the micro level. And so there are individuals who have suffered losses from which they will never financially recover. They're individual businesses, small businesses, medium businesses, maybe some large businesses. But in total, the economy will recover. In total, the economy is well on its way to. What has happened is that the stress of an unprecedented complete shutdown of the economy and then trying to restart it has fed some things that were occurring already and has caused a larger, we talk about income inequality. This is an interesting statistic. In the month of January, is this right, January? Household savings, let me just put it this way. From February to February 2020 to February 2021, the average family, their savings, the average, you understand the average and the mean, the average family in the US, their savings increased by about $15,000. And then when I hear Candace talk about her business and her 15 employees, and if I'm her, I'm thinking, there's no way that that's possible. Is that all Jeff Bezos? Now, the average does get affected by Jeff Bezos. And I don't know what the midpoint is on this, but the average family's savings increased by $15,000. And so the whole notion of not somewhat income inequality, but certainly wealth inequality, the differentials were massively exacerbated in the last 12 months. And it happened for a lot of reasons, some of which had to do with who we macro, from a macro standpoint, defined as essential. And then another thing that happened was that we have had lots of people who never missed a paycheck, who have received a check from the government, and at the same time, not only have they received a financial windfall, maybe they've had other difficulties, they've received a financial windfall, but they've had less opportunities to spend that windfall over the last 12 months. And then you have other industries that we have asked to bear a massive proportion of the economic cost for distancing. And that's the restaurant business. We have essentially told the restaurant business, restaurants, gyms, and bars that, hey, you guys are the spread point on this, and we're going to shut you down. And I've actually written this, which is, if we've decided as a community, this is not our purview, but you know what? If we've decided as a community that it is in the community's best interest to shut down those industries, then we have an obligation morally as a community, in David's opinion. And the obligation that we have to those industries that we've shut down is much greater than it is to the people who continue to have jobs and never missed a paycheck and accumulated $15,000 of savings in the last 12 months. There's the end of my sermon. But Josh, the economy will recover. There are individuals within it who will not.
Allison, how is the inventory for homes for sale? As I understand it, people don't want to open their homes for fear of contagion. People are staying in their homes. I assume the real estate market has taken it on the chin as well.
No, that's not true at all. It's actually the absolute opposite.
I'm asking the realtor in the group, though.
Oh, sorry. Go ahead.
Our inventory was extremely low before COVID. It was the nature of the economy. With the lower interest rates, typically Knox County, now this is, I don't have numbers in front of me, I didn't know this was coming, but typically we have 7,000 to 10,000 units in Knox County available on our MLS. I looked a couple of weeks ago, we had 1,400, and that's from $26,000 house to a $16 million house in Knox County, and we've got 4,600 real estate agents trying to sell those 1,400 units. And U-Haul, I think, noted East Tennessee was one of the more common places that they were moving to or hauling to. I guess they don't know if they're moving, but they're hauling. But our inventory, if you put a house on the market and it's clean, it's going to sell, which is really good because, but the problem is inventory. And I don't think it's necessarily COVID related, because it was prior to that. COVID has kind of, certain class of houses, you have to have new construction in order for this, the older people to come into, and then you have to have the availability of houses for it all to move. It's all a work in progress. And a lot of that, our new construction back in the recession had gotten to a point where we had about 2 years worth of an inventory, and we normally have about a 6-month inventory. Now, if you're wanting to build a house, it's going to take probably about a year to get a builder to break ground because everybody's just waiting to do that. And then those people that are waiting for their new construction house, they're not going to put a sign in the yard because they're going to be homeless. That's why it's not progressing as quickly, or the inventory isn't as prominent as it normally is. In my opinion, I don't have any data in front of me, to give you accurately. If you want to sell and you have a basement of somebody's house to move into, you're going to get a lot of equity right now, and you're going to sell it quick.
And then have nowhere to go. So,
Well, that's why I said you need a friend's basement. But since I do have the attention, and you have to forgive my voice, I'm not real sure why we're going on Knox County schools and we keep harping on the schools being open. It was, in-person schools have been open this whole time in Knox County, except for the delays of opening. My child is virtual. He's thriving. We have, went through a lot of hardship trying to make all that scheduling happen. He has 100% attendance. And when I say thriving, I mean thriving. I mean, it's been difficult. We give him a lot of support. I have that availability in my family structure to do that. A lot of people do not. We felt initially that by going virtual that we were helping the in-person classes because there was going to be a reduction of the population where they could social distance and we could absorb him staying at home, and he had the ability, and we thought that he had the emotional stability to be able to do that. So that was our personal choice. But for Knox County schools, they have been open to the children that want to do in person. I do feel sorry for some of them because they've not had 100% attendance because of if little Johnny over here at the table has a direct connection, then these people have to quarantine. And a lot of his friends had, gotten 14 days or whatever. I think it might have been 10, just because of, I don't want to say contamination. I don't know the word, but I think that kind of hurt the in-person. But if you want my opinion on opening and removing some of the restrictions in Knox County to where everything is open, I don't think that the money's going to come from that. I still know a lot of people who are very COVID conscious that are not in that 75 obese or whatever the category of the people who are the most affected, because a lot of people have direct contact with those people and they don't want to go out into those places because if they got it, they would bring it home to somebody that they are, a partial caretaker to. And I think that what we can do, in my personal opinion, is to make every dollar count. Knox County needs every person's dollar to make our economy work. It needs the people who are health restricted. It needs the people who are not health restricted. The small businesses, they can't afford to just have, I don't know what Dr. Chu said, was it 18 to 65-year-olds that are, less affected. It needs everybody's money. And so I feel like that we should highlight more COVID protocols in businesses and make it seem it's okay to come in here. We have went through all of these steps to make this environment inviting for you to come in safely. Not necessarily open everything up, just like nothing is not existing anymore, because in my opinion, it's about 50-50. It's about 50-50 the people that want to go full throttle, and it's about 50% of people that still have personal convictions or restrictions that they need to be more cautious, more considerate, or more benevolent, or whatever their heart is laying on them at the time. But their money is important too. So I feel like if we could positively make environments known, that will help, not necessarily pushing for the government to open everything as if it wasn't, normal, as if it were 2019. But there's my 2 cents. It exceeded the.
Excuse
So
me,
you're-
I have to leave the meeting. Apologies. So I'm going to sign off now. I am sorry. I look forward to the minutes and all that sort of stuff, but I must go. Bye.
Thank you, Raymond. Allison, if I hear you correctly, you'd like to see more concrete steps that would allow people to feel comfortable going into all kinds of places and open up in that way.
I think that'd be more beneficial than removing every restriction and make it to where it was like 2009.
Okay.
Sorry, I've had a lot of communication the last couple of days. I think it would be more beneficial that people feel comfortable at every level, whether even if they don't have health concerns, to go into places rather than absolute no restrictions.
Thank you. Dr. Smeltzer, people have been referencing mental health a lot. I wondered if you could comment on your caseload these days. Is it lighter than ever? Maybe she didn't hear me. Carletta?
Sorry, I couldn't hear you.
I said that there have been several references to mental health, collateral damage and mental health, and I was wondering if your caseload is easier and lighter than ever.
It is quite the opposite, as you can imagine. I was just talking to my colleague a second ago when I had my camera off, just about the increase in referrals and need for mental health services in the community right now, which is not surprising during a pandemic. So yes, it's different. I think I'm helping with coping mechanism. I think everyone is at capacity. I think if you think about like a rubber band, everyone's kind of really stretched thin in all different areas of life, whether they're trying to adapt to working from home or maybe they're asked to go back into the office and what that transition looks like as well.
Yeah, there are a lot of people who are now working on waiting lists in our profession. And I'm starting to see more health professionals who have post-traumatic stress issues, who are burned out. At one time, I was seeing people in other states that were calling in on a distress line, but now it's more localized, including health professionals who have contracted COVID and are still struggling to get better. Regina, are you there?
Yes, I'm here.
And as I recall, you're a nurse practitioner?
I am, yes.
What are you seeing with your colleagues in terms of coping with all of this and where we're going? What are your thoughts in what you've been hearing today?
Opening up would be great. There's a couple issues. I agree with Allison about making people feel comfortable. At the beginning of this, I avoided a lot of places just because I go in and not even 50% are wearing a mask. And that made me feel uncomfortable because of the population of patients that I care for. There was a comment made earlier about the spread of COVID and the possibility of we don't know that the 18-year-olds are spreading it. Yeah, we do. We know that if we go out, if you have younger population out and they're gathering, they are less likely to practice social distancing and they are less likely to follow mandates because they feel they are invincible. However, their invincibility is taking it back to their grandparents or even their parents because of their health conditions. So, in saying that, I know that's how it gets spread. That's the only way COVID has been introduced into a nursing home facility or an assisted living facility is by someone else. Our patients aren't going anywhere. They're not seeing their family. So the only way it came in is by staff. They were 99% of them, non-symptomatic, but yet they were positive. So that's been a big concern of ours. And employees were sent out off for a couple weeks, but the damage was done. Our patients were exposed, and that's how it spread. So they are walking around and living their lives and spreading this virus, and they don't know it. But yet enforcing throughout this whole year of 2020, you just didn't have enforcement of the regulations, of the mask mandates and social distancing. I saw it too many times whenever I did go out. But, we do have the vaccine now. It is getting out there. I do feel like we do need to start, and we have to start opening up. This is a whole new world. We've had pandemics in the past, but our world now is so different from the last real pandemic, at the turn of the century. So we can learn from that, and it didn't resolve overnight. That influenza outbreak lasted 2 years. So I don't expect this to go away overnight. But I do agree we need to start making some concessions and some progress as we get the vaccine out to more people.
Regina, has your staff and the people that you take care of, have they received vaccines?
We have, yes. Yes,
So
all of our patients that wanted the vaccine has received 2 doses. We have our 3rd clinic set for this week. I personally spoke with my patients that declined the vaccine. So I had near 100% vaccination rate in our patients.
So also, Regina, what have you heard from other care facilities that are doing similar work? That are they also receiving the vaccines in their the care homes and also their staff members?
Yes, we are. I can't tell you the rate of vaccination on our employees. I want to say it's somewhere around 50%. There is still a lot of negative feedback about the vaccine and a lot of hesitancy in people. And age, it doesn't seem to matter. I see it from 18 all the way up to, my patient population in their 70s and 80s. There's a lot of misinformation, and unfortunately, social media has really spread that.
So, but in your opinion, then it sounds like the county has done a great job, and the healthcare community has really targeted the care homes and the staff members at the care homes.
It's not necessarily the county. So the way it works in the nursing home setting, now I'm not sure about assisted living, but with us, we have a pharmacy partner, and that pharmacy is charged with vaccination distributing. So they are actually the ones that come and do the clinics. It's not the health department. So that's actually came from a corporate pharmacy. They vaccinated all the patients that wanted vaccinated, and also the employees.
So it was a coordinated effort then by public and private
Yes.
efforts, it sounds like thus far, really prioritizing those who are most vulnerable, it sounds like.
Yes, definitely.
I think this is what I'm pointing to, is that this is a good thing, right? So we are talking about the most vulnerable populations and staff members that are caring for them. I think this is a year ago, we didn't have this tool. And our county is doing a great job with public and private means to getting it out to these individuals. So I think that's why we're seeing some of those numbers come down. Great work from Regina and her staff to help with those things. Hopefully the staff members are making their decisions on vaccines soon. And so I think that's why we can say, hey, this is great news. And maybe we can inch the ball forward.
I think that segues into another question. I was a little sorry that Raymond left because I was going to ask if, because there are long lines, that means we shouldn't encourage people to get vaccinated. And Dasha, is it Dasha or Dasha?
Daisha.
Daisha, I missed the third one. As we know, I'm curious to know, people in District 1, we know that people of color have the highest incidence of illness of chronicity, things that would make them most at risk for bad outcomes with COVID. And yet the inoculation rate in the inner city communities or the Black communities lags. There's, whether it's the Tuskegee experiment or other objections, but these are people, as well as our less informed Appalachian community, who are resistant to the vaccination. And I was wondering how we could get our commission to encourage greater participation in vaccinations. I wonder what your thoughts were about that.
Well, currently the county health department is really focusing on that population and working with several nonprofits and community leaders. You know, that with so much that happened to Black people in the past, I don't blame them and I don't judge them for that. Like as you stated, the Tuskegee experiment, I struggle with getting a vaccine as a physical therapist because I have had things happen to me in the medical field that, I have a hard time trusting the science too. And thank God that I am a physical therapist, because there's plenty of times that I knew my doctor was wrong and I told him he was wrong. So I'm fortunate enough to have that and have that healthcare background and can just make that decision for myself. But yeah, so I mean, there's people out there advocating for it. I'm a person that I just want to give people, I want to empower people to have a choice. I don't think we should judge people. If they don't want the vaccine, that's their business. That's their body. If someone wants it, give it to them. But I think that is just a lost battle, because it's going to get back into the whole fight with mask versus no mask. Is COVID real? Is it not real? I don't think that's the focus. I think, I was sitting here listening to everyone. And I just want to also reiterate, I thank you all for joining the committee. I love what everyone had to say. I've been taking notes. But, I think this is a time that we can use this time to really figure out how to bring our community together to help solve these solutions. I'm feeling, Candace, I feel your heart. And I don't know if it's a small business campaign that comes out of this. How does that look? I don't operate, I can't make that decision because I do not have a restaurant business, but I love to eat. And so, I mean, we have to be solution oriented. And I love what Allison said, make every dollar work. How does that look? And just really, and I mean, I think I heard Dr. Chu and Kathleen and Candace say, we need to really emphasize unity. Like, how do we become the solution? We are not going to save the world from COVID, nor some people don't want to be saved. And we can't go in carrying that burden, but we can empower people to have a choice. If you want to go out to eat with your friends and there's 10 of them, I mean, I know everybody's going to disagree, but people have a choice. They need that choice, but we have to get back to respecting each other. And we have lost that. Completely lost it. And that's why we have this huge disruption of everything, the homicides, I mean, everything, because, and speaking on the kids, because we did lose one this morning, they are just reflecting what they see on TV. We have lost our minds. We have let COVID divide us. And I'm hoping this committee can just figure out the solutions. I know as a committee, we are not going to agree, but we have to focus on solution and look outside what our belief system and carry Candace's burden for just a little moment. How does it feel to be an entrepreneur, a small business? Dr. Chu, how does it feel? How does Allison feel? Like walking other people's shoes. And then I think that will help guide us in what Commissioner Ward is asking us to do. That's my 2 cents. I'm like, I guess it was David Moon. He like, I didn't say my sermon. So,
Well, I'm glad we had you at cleanup because you put it all together, didn't you?
yeah, but you know, and it's, I mean, it's hard, but you know, this won't last forever. I mean, I don't know, COVID might be around forever, just like the flu came, but it was a pandemic in 1919. We just got to get it together and communicate and respect each other. I am not mad at anybody that don't wear a mask. I go to the other side. I wear my mask. I say hi. I don't curse them out. I don't say dumb. I mean, I don't say nothing. That's their business.
If I could just add just one more thing, and I think, Daisha, you kind of brought this up, but also, you know, this loss of respect and so forth, this isn't the only thing we've dealt with this year.
Mm-hmm.
We have racial tension in this country that is at an unprecedented level, that is one of those contributing factors to violence, to this disrespect, to this discord. We had an election that was, I don't know, the most stressful in my lifetime for what I saw, people pitted against each other, and the violence that erupted around that. So I am hard pressed to put everything on COVID when we had a lot of other things going on simultaneously that increased the stress in our communities. So I don't think the solution alone is undoing the restrictions that COVID has precipitated. And I do agree with you, reaching out to each other. We've got to work together on this, on all these issues.
Yeah.
But I don't think there's a single solution, and I don't think it's all COVID driven.
Right, and it's everything is multi-layered, and I think that's why I feel for some of our small businesses, our restaurants, is like they got blamed because of COVID. They had to either shut down or reduce capacity. So I mean, I understand that part, because we just like, oh, COVID hit, let's just shut everything down. And I think we did that because we just didn't know. It was scary. I mean, I still work because I'm a physical therapist. I was scared going to homes. They was like, the hospitals were just discharging people. And that's before they was even testing. So I'm nervous, like, okay, if someone had pneumonia or something, I mean, am I exposing myself to COVID? But yeah, it's like you said, Kathleen, everything's multi-layered, but we are in this disruption. I feel like God has called us to this playground. He locked the gate. He said, I'm not going to let you out till you learn how to talk to each other. And that's why we had the George Floyd, we had a crazy election year, COVID, all this stuff is going on because we are so scared to communicate. And then when somebody disagrees, it's like you're the devil. We have to stop that. We have to stop it, and it has to stop now. Are we just going to continue to have meetings and talking and nothing's going to be solved and everybody's going to be frustrated and then we're going to be in the same boat? But I totally agree with you, Kathleen. It's not just COVID, it's everything. I think Dr. Chu said something about the pressure cooker. I guess that was you, but I mean, we in there. If we don't get it together, we are really going to explode. I feel like we already exploded, but
as the chair, I think I have to hew over to the Robert's Rules of Order just for a moment. There are a couple of unfinished things. At our last meeting, there was the one consensus we had was that we wanted a pair of teachers on this committee. And I suspect we need to formally have a proposal for that and actually vote on it. I'm guessing because the commission is not doing anything. The other question is, how do we have the right to appoint our own people to this committee? There's, Dr. Chu, there's infrastructure issues right here in Capital City. We have no guideposts as to how we should proceed. Also, the question I posed at the very beginning of the meeting had to do with how we define this committee and whether we see ourselves as a working group. And if we do, meeting once a month or once a year is laughable. not much will come of that, because by the time we meet again, we'll have forgotten everything we did the last time, and there's no forward motion. And whether we want to delegate to ourselves specific topics that we want to focus on, as the commissioner has asked us to, or whether we want to dwell on one thing and do it right and do it well. I don't pretend to have the answers to that. I defer to the group in considering this. But I do think we need a motion if we want to at least have the teachers present.
I think you're probably going to have some legal advice. So it would, Mr. Buke be the individual to ask if this is something that we can self-appoint, or is that something that has to be brought back to the commission? I'm not sure. Maybe Dr. Lundy can help us with that.
It will have to be brought back to commission, since commission created the committee. So what we can do, we can make a recommendation.
Our first recommendation, then a formal recommendation, let the minutes reflect that we have recommended the appointment of a teacher and a special education teacher. We're talking about K through 12 teacher, not a professorial type. We have enough of those around. I say that with affection. Any other thoughts about frequency? So, Allison, I guess the record needs to show that we are formally requesting the appointment of a teacher, 2 teachers.
K through 12, and then if memory serves, there was one a special need K through 12 as well.
Special ed, right?
So the only thing that needs to be reflected in the minutes, Allison, is like who made the motion and who seconded, and and then the exact motion, then that's the only thing that needs to be reflected.
Unfortunately, guys, I'm sorry, but I have to leave. I'm getting ready for dinner service. So
What's for
everything
dinner?
will be in the email. I know, right now I'm doing grouper.
Ooh, we're
Yeah,
on
my
our
cook-
way.
My cooks just said, Candace, we need you. And I'm like, okay, I'm coming. So
Candace,
peace out.
Thank you
Yes.
for your passion and for the clarity of what you said earlier. Thank you very much.
No problem. I love being on this commission. I'll help you.
Good deal. Okay, we're not getting closure. We're going to meet the second Wednesday of April, it looks like. I don't really know how we're supposed to correspond, if we're allowed to correspond, if we can have group emails or what. I have no idea.
You can go through Andrew, and Andrew can send just email Andrew and say this is the time, and someone can do a calendar invite. If we ever want to get together in person, we would have to do a public notice.
What about from person to person? Let's say I wanted to send you a note.
I mean, it gets sketchy, and that's something not Dr. Butte, but the law director can tell you, because there's a lot of stuff that, I'm still kind of learning, but we are not allowed to discuss like policies and how we're going to vote on stuff. I mean, sometimes I just comfortable with doing public notice stuff before I talk anything about this committee. Like, you can call Dr. Chu, it's like, hey, how you doing today? You can call him about that, but I get really
yeah, but if we have a beard, there's no telling what we're going to start talking about.
And that's why we public notice. That's why commissioner, sometimes Commissioner Durant and I just want to go out to eat, and we just can't do that. We have to public notice, and people can come eat breakfast with us.
So we're going to all be at the Bearden Beer Garden at this time and play whatever.
We have to tell people. So, yeah.
I don't drink, of course. So
The last meeting, I may be a little confused about this, but we did have a motion to add the teacher, and then we all voted unanimously on that, and it was submitted. Do we need to do it again?
I think we need to remind them that we did that. Yes.
We did get the email. It's just I was leaning on the Commissioner Ward since he this is not his committee, but this is something he felt strongly on doing. But we can we work it out. I don't know if it's gonna be on this agenda.
Okay, so we still have an open process, which is fine. We'll feel our way through this. As of now, the way we've set it up, we'll be meeting, I don't have a calendar, but it's the second Wednesday of next month at the same time. I would prefer to continue to have it for a 2-hour period. We can end sooner if we choose to, but I will book 2 hours. And David can leave if he needs to.
That's the 14th. Is there anything on that in his Mr. Ward's letter that we want to add as a topic of discussion next month? Or if any of us want to personally take it on to do some investigating?
I think he was being generous in giving us some suggestions, but I think we're still feeling our own way as to how we're going to proceed. So
Okay.
if I could have a motion to adjourn
Move to adjourn.
and second. I
Second.
think all the ayes have it. Thank you all so much for your work and your thoughtfulness. This has been very enlightening. We'll see you soon.
Thank you all. Have